Hello, my name is Nicole, and today we are going to be talking about sleeping disorders. An overview. What are sleeping disorders? Sleep disorders are conditions that disrupt regular sleep patterns. They affect individuals' ability to sleep consistently well. They have an overall impact on your health, emotional well-being, and daily function. Why are they so important? Sleep plays a crucial role in not only your mental health, but your physical health. When you don't have good sleep, it's going to affect a variety of health issues such as heart disease, obesity, diabetes, and the mental disorders. Understanding sleep disorders is essential for recognizing their impacts on quality of life and developing strategies for intervention and management. And sleep helps your brain work properly. If you are not sleeping right, it is not going to get you ready for the next day. We need sleep to form new pathways to help learn and remember and store information. There are 6 different common sleep disorders: insomnia, lack of sleeping, a difficulty falling asleep or staying asleep; sleep apnea, breathing interruptions during sleep like snoring; movement disorders like restless leg syndrome, uncomfortable sensation in your legs, and this leads you to the urge to move; narcolepsy, too much sleep; sudden and uncontrollable episodes of deep sleep. Other ones are circadian rhythm disorders. Usually you see those in people who work late nights or night owls; and sleepwalking. Let's dive into the overall biophysiosocial perspective. Biological factors. A lot of us are genetically predisposition. Certain sleep disorders such as insomnia, narcolepsy have a genetic component that increases the risk. Neurotransmitter imbalances. This can help affect your sleep regulation. Circadian rhythm disorders, as we talked about, irregular sleep-wake cycles due to a shift in your work cycle, or jet lag, or irregular schedules that are going to help contribute towards these sleep disorders. Psychological factors: stress and anxiety. Hyperarousal, it's chronic stress or anxiety can lead to a state of hyperarousal, and this makes it hard to fall asleep and stay asleep. Rumination, the persistent worrying and negative patterns, keeping your mind active. It's not going to help with sleep onset, and it's going to interfere with any relaxation that you're trying to achieve. Mental health conditions, depression, these can change your sleep patterns. They can bring on insomnia, and this is common with depression because it has to do with altered levels of serotonin. PTSD is also another one, and it can cause nightmares, which eventually will disrupt sleep. Social factors, lifestyle and environment. So your work schedule, irregular work hours, shift workers, this can lead to a messing with circadian rhythm, and then you'll have insufficient sleep. Family and social support. When you have lack of social support or a stressful family dynamic, it's going to exacerbate these sleep issues. And then there's a cultural aspect of the attitude towards sleep. In some cultures, it's you want to prioritize productivity over your sleep time. And then, the technology use. This is something we're seeing a lot now. Increased screen time, especially before bed. This is going to disrupt your melatonin production, and it's going to delay sleep onset. Assessment instruments that are used for sleep disorders. The PSQI, Pittsburgh Sleep Quality Index. This is the #1 self-reported used instrument for assessing sleep quality over a 1-month period of time. It was developed in 1989 by Biassy. It evaluates various dimensions of sleep: your sleep duration, disturbances, daytime dysfunctions. It contains 19 self-rated questions and an additional 5 questions for your partner or your roommate. It's used in the field to identify poor sleep quality amongst a variety of populations, and it's used in a clinical and a research setting. It tests sleep quality, measures subjective perception of sleep, time taken to fall asleep, the total hours to sleep per night, a ratio of sleep time to time spent in bed, and your daytime dysfunction. It impacts of poor sleep on daytime activities. And the scoring is easy. It's done in a range of 0 to 21, with higher scores indicating poor sleep quality. A score above 5 suggests significant sleep disruptions. In the research in public health, it enables research to identify trends in sleep disturbances across populations. These populations are older adults, students, or patients just with chronic illnesses. The PSQI data can inform how we change policy and awareness around sleep health. The current research that is being done on sleep, as we know, and it's also the most commonly used evidence-based, is cognitive behavioral therapy for insomnia. This is a first-line treatment for chronic insomnia, it demonstrating significant improvements for sleep quality as opposed to a pharmacological treatment. Nowadays, many people have access to digital CBT for insomnia platforms, and it's showing that it has comparable effectiveness to in-person therapy. Research is showing that long-term benefits of patients who receive CBT report sustained improvement in their quality of sleep even after the treatments end. Recent advancements on the pharmacological side of things, there's new medications as the FDA only approves medications for short-term use as they have high dependency. There is a new class of medication, orexin receptor antagonists, and they are shown to minimize the side effects associated with the traditional sedatives. Evidence supports that we should tailor depending on an individual's patient profile. We need to consider things like comorbidities, their age, and their treatment history. Research is showing that adjunctive treatments and lifestyle changes are effective. Incorporating lifestyle changes such as exercise, light therapy, it's showing to have a better outcome. Studies show that patients who engage in regular physical activity report better sleep quality and duration. People who are now receiving techniques such as hygiene education, sleep hygiene education, and relaxation techniques have been shown to advance the effectiveness of cognitive behavioral therapy. The path forward. So we're seeing that there is a continued need. We need to continue doing ongoing studies, and this is essential for creating treatment protocols and identifying the optimal combination of these therapies for a diverse profile of patient populations. Research is showing that cognitive behavioral therapy mixed with pharmaceutical therapy and lifestyle changes do yield the best outcome. So, and then the future direction, as we talked about these technology-based platforms for being able to provide CBT to a broader range of populations is going to be a big leap forward. So now that we talked about the research, let's just talk about the evidence-based treatments for these disorders, focusing on behavior and pharmacological approaches. The gold standard treatment for chronic insomnia is cognitive behavioral therapy for insomnia. This is going to challenge patients' unhelpful beliefs about sleep, have behavioral strategies, which include sleep restriction and stimulus control. The research supports this. It's effective in both in-person and digital forms, which is now increasing the accessibility to more populations. It provides long-term improvements and it reduces risk of relapse compared to the medications that are addictive. Pharmacological interventions. These are typically used short-term, and it's when the non-pharmacological methods are insufficient. Common medications are benzos. These are effective, but they have a risk of dependency. There's non-benzo receptive agonists. These are used as well, but the recent research has been showing promising for dual orexin receptor antagonists. These offer a safer option, and they're more long-term because they're not addictive. Intervention, these pharmacological interventions, the guidelines, they do show that we should limit the use of sedative medications to avoid dependency. And these need to be integrated with behavioral therapies for the optimal outcome. adjunctive treatments that have been used and show promising. Light therapy for managing circadian rhythm disorders by adjusting the sleep-wake cycles. Exercise, this is probably the most underutilized, antidote for not only sleep issues, but also anxiety, depression. It enhances sleep quality. And this is especially for those with depression. Melatonin, this is another supplement that can be used. It's best for circadian rhythm adjustments rather than just going for a direct sleep inducer. The effectiveness does vary depending on the individual's melatonin levels. And the best overall, which we saw by the research too, is integrating all of these treatments for the optimal results. A holistic approach does show combining CBT with the pharmacological interventions and lifestyle changes is going to yield you the best result. The research has shown it emphasizes individualized care to address both behavioral and biological aspects of sleep. Outcome focus improves sleep quality, reduces daytime dysfunction, and it fosters a long-term management. So, it's not going to be a one-size-fits-all, but integrating these treatments has really shown optimal results. Overall, as we reviewed, sleep disorders do impact health. They impact you not only physically, but mentally. They're going to influence your productivity, your emotional well-being, and your overall quality of life. And that's why it's something that needs to be paid close attention to. It is very important to diagnose and treat these. Early diagnosis and effective treatment options like CBT or medication or just lifestyle adjustments can greatly improve the outcome of those affected. We need to promote sleep hygiene. This can be done early on or on the onset of a sleep disorder. Implementing good sleep hygiene practices such as keeping a sleep schedule, limiting your screen time, and managing stress can help prevent and alleviate the disorders. The future direction. So continued research and awareness are essential for not only understanding, but treating and destigmatizing sleep disorders and promoting healthier communities overall. It's the end of my presentation, and I hope you enjoyed and learned something.